This video is on pancreatitis. Pancreatitis is the autodigestion of the pancreas due to inappropriate activation of pancreatic enzymes within acinar cells. Pancreatitis presents with severe epigastric pain and can be associated with nausea, vomiting, diarrhea, and fever. To examine the pathophysiology of pancreatitis, we want to understand the mechanism of inappropriate activation of enzymes. There are three main ways that can be appreciated by looking at this diagram. Normally, bile would flow through the bile duct and combine with enzymes in the main pancreatic duct at the ampulla of Vater, that then move into the duodenum to aid in digestion. However, a gallstone can obstruct this through lodging at the ampulla of Vater. This causes retrograde flow of bile back into the pancreas that irritates it. Secondly, acinar cells could be directly injured from chemical, mechanical, or infectious causes. Chemical causes include alcohol and thiazides. Mechanical causes include trauma, and infections from EBV, CMV, and Coxsackie virus are possible. Finally, drugs such as thiazide steroids and NSAIDs can cause pancreatitis. This causes trypsin to be activated, which activates the other enzymes and then circulates in the blood. Protease directly damages acinar cells, lipase and phospholipase causes fat necrosis, and elastase damages blood vessels. This is important when we think about complications. So complications can be divided into early and late complications. An important early complication is acute kidney injury. This is because autodigestion of the pancreas causes peripancreatic inflammation and third spacing. This hypovolemia and hypotension leads to a pre-renal acute kidney injury. This is why it's important to check UECs in investigations. Also, this could be exacerbated by elastases that erode blood vessels, causing hemorrhage. In this case, the blood would irritate peritoneal nerves, causing patients pain to radiate to the back. You would also present with signs of shock such as tachycardia. Further, the production of insulin is reduced to destroyed beta cells, leading to hyperglycemia. Lipase and phospholipase causes fat necrosis that results in saponification of calcium, leading to hypocalcemia. This is potentially fatal because it can lead to ventricular fibrillation. An ECG would look for this and signs of Torsades de Pointes such as a long QT interval. As trypsin activates prothrombin, it can cause disseminated intravascular coagulation. This means clotting factors are not used properly. So some areas of blood do not have clotting factors, which can result in hemorrhage. Also, pancreatic necrosis can occur, so look out for Gray Turner and Cullen sign, so bruising on the flanks and umbilical region respectively. If pancreatitis persists, there may be late complications. From the pathophys section, we know that there is disruption of the pancreatic ducts. Hence the digested pancreatic juices, as the pancreas is eating itself, remember, and tissues go outside the pancreatic ducts, and this leads to pancreatic pseudocysts. If it leaks, it can cause pancreatic ascites. Also, there's a risk of splenic and portal vein thrombosis. This is because the portal vein drains the pancreas, and the splenic vein travels along the superior surface of the pancreas. In terms of investigations, I've already talked about what you can look for to monitor complications, but you want to look for a cause, so abdominal ultrasound may show a gallstone, especially in the ampulla of Vater. Also, a CT with contrast will show viable tissue and allow non-viable tissue to be biopsied to differentiate infective from sterile or non-infective causes. Treatment focuses on supportive care and stopping progression of pancreatitis. Oxygen and pain relief can be given. Patients should be made nil by mouth, and a nasogastric tube can be inserted to rest the pancreas. IV fluids can also mitigate hypotension and acute kidney injury. Hartmann solution is good in this low blood volume context. Thank you for watching. If you learned something, please show it to a friend who may also find it useful.